Question 1. In the context of mammography procedures, Mrs. Thompson is scheduled for a routine screening mammogram. She is visibly anxious and expresses concern about the procedure being uncomfortable. As a mammography technologist, what is the most appropriate action to take to ensure her cooperation and comfort during the exam? A. Explain the steps of the procedure and reassure Mrs. Thompson that the procedure will only take a few minutes. B. Proceed with the exam without further communication, as patients are typically aware of the procedure. C. Ask Mrs. Thompson to reschedule the exam when she feels more comfortable. D. Explain the procedure thoroughly, including its importance, and provide psychological support to help alleviate her anxiety. Answer. Correct answer. D. Explain the procedure thoroughly, including its importance, and provide psychological support to help alleviate her anxiety. Explanation. It is crucial to establish a rapport with the patient before and during the procedure. By thoroughly explaining the steps and the importance of the mammogram, as well as offering emotional support, the technologist can alleviate the patient's anxiety. This aligns with the patient-centered care approach, emphasizes communication and psychological support, ensuring that the patient is informed and feels comfortable. According to the American College of Radiology (ARRT) guidelines, effective communication enhances patient cooperation and reduces the discomfort typically associated with mammography. Question 2. When considering the patient's medical history, what factor is most critical to assess when determining the need for additional mammographic views beyond the standard craniocaudal (CC) and medial-lateral oblique (MLO) views? A. The patient's age at the time of the first mammogram. B. The presence of family history of breast cancer or genetic predisposition. C. The patient's body mass index (BMI). D. The history of benign breast conditions in the patient. Answer. Correct answer. B. The presence of a family history of breast cancer or genetic predisposition. Explanation. A family history of breast cancer or a known genetic predisposition such as EIA mutations is a critical risk factor in determining the need for additional views during mammography. According to the American Cancer Society Acts and ARRT guidelines, patients with a strong family history of breast cancer may require additional imaging, top compression views, or ultrasound to detect malignancies early. This can enhance the sensitivity of mammography in patients with dense breast tissue or those at higher risk of breast cancer. Question 3. Which of the following is the most important factor in determining the appropriate radiation dose for a mammogram while maintaining compliance with ARRT as low as reasonably achievable principles? A. The age of the patient. B. The type of mammography equipment used. C. The size and density of the patient's breast tissue. D. The previous history of breast cancer in the patient. Answer. Correct answer. C. The size and density of the patient's breast tissue. Explanation. The radiation dose in mammography is primarily influenced by the size and density of the patient's breast tissue. Dense breast tissue requires higher radiation exposure to produce clear images, while fatty tissue requires less. However, the ARRT principle dictates that exposure should be kept to minimum while still achieving diagnostic image quality. The technologist just the exposure factors based on breast composition, taking into account the patient's comfort and minimizing radiation risk. This approach aligns with the FDA's Mammography Quality Standards Act (MQSA) regulations, which emphasize dose optimization. Question 4. Mr. Martinez presents for his annual mammogram. Upon review of his prior mammograms, you notice a subtle change in the tissue that could suggest a developing abnormality. What should be your first step in handling this situation? A. Proceed with the current exam and await the results from the radiologist. B. Inform the patient immediately about the potential abnormality. C. Compare the current images with the prior mammograms and consult with the radiologist for a second opinion. D. Reassure the patient that everything looks normal, as changes can sometimes be benign. Answer. Correct answer. C. Compare the current images with the prior mammograms and consult with the radiologist for a second opinion. Explanation. When a change is observed in a mammogram, it is critical to compare it with prior images to assess whether it is a new development or a stable finding. Consulting with the radiologist ensures that the concern is appropriately evaluated and the patient can be informed if further imaging or follow-up is necessary. Practice follows the ARRT guidelines on the importance of comparing current mammograms with prior exams to assess any changes in breast tissue, which helps in early detection and accurate diagnosis. Question 5. To better understand breast cancer risk, how might one explain the relationship between hormonal influences and the development of breast cancer in a patient with a history of hormone replacement therapy (HRT? A hormonal therapy reduces the risk of breast cancer by balancing estrogen levels. B. Estrogen exposure, particularly with HRT, can increase the risk of developing breast cancer. C. The risk of breast cancer is unaffected by HRT use. D. HRT provides a protective effect against breast cancer by regulating progesterone levels. Answer. Correct answer. B. Estrogen exposure, particularly with HRT, can increase the risk of developing breast cancer. Explanation. Research has shown that prolonged estrogen exposure, such as from hormone replacement therapy (HRT), can increase the risk of developing breast cancer, especially when combined with progestin. According to the ACTS and the Women's Health Initiative, the use of combined estrogen and HRT has been linked to an elevated breast cancer. Estrogen alone may also increase this risk, especially when used for extended periods. Patients with history of HRT should be closely monitored through mammography and other screenings as part of comprehensive risk assessment. Question 6. Considering recent advancements in mammography, which of the following technologies has shown the most promise in improving the accuracy of breast cancer detection, particularly in women with dense breast tissue? A. Standard TORD mammography. B. Digital breast tomosynthesis (DBT). C. MRI breast screening. D. Ultrasound imaging. Answer. Correct answer. B. Digital breast tomosynthesis (DBT). Explanation. Digital breast tomosynthesis (DBT), also known as 3D mammography, has shown significant promise in improving breast cancer detection, particularly in women with dense breast tissue. Dense tissue can obscure tumors on traditional TORD mammograms, making it more difficult to detect early-stage cancers. DBT creates a 3D image by capturing multiple slices of the which helps to reduce the masking effect of dense tissue, providing clearer images and enhancing diagnostic accuracy. This technology aligns with current recommendations from the ARRT for improved detection in patients with dense breasts. Question 7. In what ways can a mammography technologist ensure proper infection control during a routine mammogram, especially considering the COVID-19 pandemic? A. Disinfect the mammography unit only between patient appointments. B. Provide personal protective equipment (PPE) to all patients, but not to the technologist. C. Adhere to standard infection control precautions, including wearing appropriate PPE and disinfecting the equipment between patients. D. Refrain from disinfecting the equipment, as it does not pose a significant risk of contamination. Answer. Correct answer. C. Adhere to standard infection control precautions, including wearing appropriate PPE and disinfecting the equipment between patients. Explanation. Standard infection control precautions, particularly in the context of the COVID-19 pandemic, include the use of appropriate personal protective equipment (PPE) for both the technologist and the patient. The mammography unit and any surfaces that the patient may have contacted should be thoroughly disinfected between patients. The ARRT and CDC guidelines stress the importance of these practices to minimize the risk of infection transmission, ensuring patient safety and compliance with healthcare standards during the pandemic. Question 8. Based on the information provided by Mrs. Kelly's medical history, she has strong family history of breast cancer but has never had mammogram before. What is the most appropriate course of action? A. Inform Mrs. Kelly that she should begin screening mammograms immediately, regardless of her age. B. Recommend baseline mammogram at the age of 40, as the ACTS guidelines suggest for women with family history of breast cancer. C. Delay the mammogram until Mrs. Kelly reaches the age of 50, as this is when screening is typically recommended. D. Recommend genetic testing to determine her risk, but postpone mammography for now. Answer. Correct answer. B. Recommend a baseline mammogram at the age of 40, as the ACTS guidelines suggest for women with a family history of breast cancer. Explanation. The American Cancer Society ACTS recommends that women with a family history of breast cancer begin screening mammograms at age 40 or earlier if there is a known genetic predisposition. Given Isis Kelly's strong family history, early screening is crucial for detecting potential breast cancer. Delaying screening until age 50 would be inconsistent with current guidelines for women at high risk. Question 9. The general consensus is that breast cancer screenings are vital for early detection. However, when interpreting mammogram results, what is the most significant aspect to focus on in the evaluation process? A. The patient's age and menopausal status. B. The presence of microcalcifications in the mammogram. C. The overall breast size and symmetry. D. The patient's history of benign breast conditions. Answer. Correct answer. B. The presence of microcalcifications in the mammogram. Explanation. Microcalcifications, which are tiny deposits of calcium in the breast tissue, can be an early indicator of breast cancer, particularly ductal carcinoma in situ (DKIS). The presence of microcalcifications is one of the most critical aspects evaluated during mammogram interpretation. While benign conditions can also cause calcifications, the distribution and morphology of these microcalcifications can provide important clues to the radiologist regarding whether further investigation is needed. The ARRT guidelines emphasize the need for careful assessment of microcalcifications in the context of overall breast imaging. Question 10. In response to increasing patient awareness, the American Cancer Society (ACS) and the American College of Radiology (ACA) recommend specific guidelines for breast cancer screening. What is the most important factor in determining when to initiate mammography screening for a patient? A. The patient's family history of breast cancer. B. The patient's annual physical examination results. C. The patient's age and risk factors. D. The availability of mammography facilities. Answer. Correct answer. C. The patient's age and risk factors. Explanation. The ACS and ACA recommend that screening mammograms begin at age 40 for average-risk women, with earlier screening considered for those with family history or other risk factors. Screening is tailored based on individual risk profiles, which may include family history, genetics, and other medical conditions. This approach ensures early detection and reduces breast cancer mortality. Identifying cancers at the earliest, most treatable stages. The ACS guidelines emphasize that personalized risk assessment is key to determining the appropriate time to start screening. Question 11. In the context of addressing diverse patient physical and mental needs during mammography, Esther Davis, a 58-year-old patient with a history of anxiety and claustrophobia, has expressed concerns about the tight compression and noise produced by the equipment. He is particularly worried that the procedure might trigger panic attacks, as he has experienced similar situations in the past. As a mammography technologist, what is the most appropriate strategy to Mr. Davis's comfort and cooperation during his exam? A. Inform Mr. Davis that the discomfort is a normal part of the exam and ask him to endure it without additional support. B. Immediately reschedule his exam to a later date when his anxiety might be lower. C. Provide comprehensive explanation of the procedure, modify the patient's positioning when possible, and offer techniques such as deep breathing and calm verbal reassurance throughout the process. D. Skip the compression phase entirely to avoid triggering anxiety, even if it compromises image quality. Answer. Correct answer. C. Provide a comprehensive explanation of the procedure, modify the patient's positioning when possible, and offer techniques such as deep breathing and calm verbal reassurance throughout the process. Explanation. In mammography, patient comfort and cooperation are critical. For patients like Esther Davis with pre-existing anxiety and claustrophobia, it is essential to provide detailed procedural information and continuous reassurance. Techniques such as modifying positioning and allowing the patient to use relaxation methods align with patient-centered care practices. Guidelines from the American College of Radiology (ACA) emphasize the value of psychological and emotional support to reduce patient stress, which leads to improved image quality and diagnostic accuracy. Skipping critical aspects or merely rescheduling the exam can compromise both patient care and the examination outcome. Question 12. With respect to the ACA screening guidelines, Isis Rodriguez, a 45-year-old woman with dense breast tissue and a notable family history of breast cancer, is scheduled for her screening mammogram. Given her risk factors and tissue density, which component of her examination requires special emphasis to ensure accurate detection of abnormalities? A. A routine TWAD mammogram only as it is sufficient regardless of breast density. B. The use of advanced imaging techniques such as digital breast tomosynthesis (DBT) in addition to traditional views to improve the diagnostic yield for dense tissue. C. Immediate scheduling for a full breast ultrasound in lieu of the mammogram. D. A solely clinical breast examination to detect any palpable abnormalities without further imaging modification. Answer. Correct answer. B. The use of advanced imaging techniques such as digital breast tomosynthesis (DBT) in addition to traditional views to improve the diagnostic yield for dense tissue. Explanation. Patients with dense breast tissue and family history of breast cancer, like Mrs. Rodriguez, benefit from advanced imaging methods because dense tissue can obscure lesions on standard TWAD mammograms. DBT produces 3D images by reconstructing multiple slices of the breast, providing a clearer assessment of any abnormalities. According to ARRT and ACT's guidelines, the incorporation of DBT improves cancer detection rates in women with dense breasts and reduces recall rates. The approach combines the strengths of standard views with the enhanced spatial resolution of 3D imaging, ensuring that both subtle and significant findings are accurately detected. Question 13. In light of recent developments regarding equipment performance and quality control, Mr. Patel, a veteran mammography technologist, is tasked with ensuring that the mammography unit in his facility maintains accurate calibration and optimal performance. His supervisor has emphasized that any deviation from the manufacturer's standards might compromise image quality and patient safety. What is the recommended first step Mr. Patel should take as part of equipment calibration and maintenance procedure according to MESA guidelines? A. Consult the patient to determine any reported discomfort during previous exams. B. Perform visual inspection of the mammography unit for any physical damages only. C. Immediately schedule the device for software update, assuming calibration issues are minimal. D. Conduct routine UC tests using standardized phantoms and compare the results with the manufacturer's performance baselines, then document the findings meticulously. Answer. Correct answer. D. Conduct routine QC tests using standardized phantoms and compare the results with the manufacturer's performance baselines, then document the findings meticulously. Explanation. Ensuring optimal performance of the mammography unit is critical for both diagnostic accuracy and patient safety. Routine quality control UC tests, as outlined by MESA and ARRT, involve using standardized phantoms to assess various parameters, such as image contrast, resolution, and overall calibration. Documenting these findings is equally important to provide traceable evidence of compliance and to detect any deviations early. This systematic approach helps in maintaining the highest standards in imaging quality and ensures that the equipment is performing within the acceptable limits recommended by regulatory bodies. Question 14. When considering proper documentation and patient confidentiality, Mrs. Green, a new patient with a complex medical history, has expressed concerns about sharing her sensitive health information. In the process of preparing for her mammogram and reviewing her medical background, what is the most appropriate action for the technologist to take to address her concerns and comply with HIPAA regulations? A. Collect all of her medical history without discussing privacy, assuming she understands the standard procedures. B. Clearly explain the privacy policies in place, the purpose of collecting the information, and how our data will be protected in strict accordance with HIPAA. C. Avoid recording any detailed information to minimize the risk of data breach. D. Pass her information directly to the radiologist without explaining the confidentiality measures to expedite the process. Answer. Correct answer. B. Clearly explain the privacy policies in place, the purpose of collecting the information, and how her data will be protected in strict accordance with HIPAA. Explanation. Patient confidentiality is a cornerstone of ethical medical practice. HIPAA regulations mandate that a patient's health information must be handled with the utmost care to protect their privacy. In Mrs. Green's case, addressing her concerns involves transparent discussion about the privacy policies, the necessity of collecting comprehensive medical data for accurate diagnosis, and the security measures implemented to safeguard her information. This approach not only reassures the patient but also enhances her trust and cooperation during the mammogram. Question 15. During the process of performing a mammogram on MS, Lee, a 50-year-old patient with a history of breast augmentation, the technologist is tasked with adapting the imaging technique to accommodate the implant and ensure diagnostic accuracy. What is the most appropriate method to achieve optimal imaging results in this situation based on current guidelines? A. Perform the standard imaging protocol without any modifications regardless of the implant status. B. Employ additional views such as implant displacement, Ekund views to visualize both the implant and the surrounding breast tissue. C. Rely exclusively on ultrasound imaging to bypass any challenges with the implants. D. Adjust only the exposure factors but not the view techniques to account for the presence of the implant. Answer. Correct answer B. Employ additional views such as implant displacement, Ekund views to visualize both the implant and the surrounding breast tissue. Explanation. Breast augmentation can interfere with the standard imaging views, potentially obscuring breast tissue. The Ekund technique, implant displacement views, is specifically designed to move the implant posteriorly, thereby allowing better visualization of the anterior breast tissue where abnormalities are likely to occur. This approach is endorsed by the ARRT and various radiology protocols for patients with implants, ensuring that a comprehensive assessment can be performed while also maintaining the integrity of the imaging. Adapting imaging techniques in this manner is essential for achieving accurate and reliable results. Question 16. According to recent studies on patient communication and informed consent, Mr. Brown, a 60-year-old patient scheduled for his first mammogram, expresses confusion regarding the consent process and the details of the procedure. What should the mammography technologist do to ensure that Mr. Brown fully understands the exam, his rights, and the confidentiality procedures in place? A. Ask Mr. Brown to sign the consent form immediately, as the process is typically straightforward. B. Provide a brief verbal summary of the procedure and ask if he has any questions later. C. Thoroughly explain the exam details, including the steps involved, potential discomfort, radiation exposure, and confidentiality measures, then allow ample time for questions before obtaining informed consent. D. Direct Mr. Brown to a pamphlet without personal explanation. Answer. Correct answer. C. Thoroughly explain the exam details, including the steps involved, potential discomfort, radiation exposure, and confidentiality measures, then allow ample time for questions before obtaining informed consent. Explanation. Informed consent is a critical aspect of medical ethics and legal compliance. For first-time patients like Mr. Brown, detailed communication is essential to ensure that he understands the procedure, benefits, and his rights regarding confidentiality under HIPAA regulations. According to the standards set by the ARRT and NSA, technologists must engage in a comprehensive dialogue that allows patients to ask questions and clarify any uncertainties. This detailed process not only builds trust but also ensures that the patient is making an informed decision regarding their care. Question 17. When evaluating the technical aspects of a mammogram, is Carter, a 52-year-old patient, has undergone a screening exam during which the radiologist noted suboptimal breast positioning and an inadequate use of compression paddles. As a mammography technologist, what is the best course of action to correct these issues in subsequent exams? A. Review and adjust the patient positioning techniques and confirm that the appropriate type of compression paddle is being used for her breast size and shape, followed by additional training if necessary. B. Ignore the comments since the image quality was sufficient for the radiologist's interpretation. C. Switch to different imaging modality immediately to avoid repeating positioning errors. D. Advise the patient to bring family member to help with positioning during exam. Answer. Correct answer A. Review and adjust the patient positioning techniques and confirm that the appropriate type of compression paddle is being used for her breast size and shape, followed by additional training if necessary. Explanation. Accurate positioning and optimal use of compression paddles are critical to ensure high-quality mammographic images, which are essential for the accurate diagnosis of breast abnormalities. In MS, Carter's case, the technologist must proactive steps to review and enhance their technique based on feedback from the radiologist. Continued education and training are recommended practices to address positioning errors. This approach is supported by ARRT guidelines and quality control measures, ensuring that any image quality issues are promptly corrected for subsequent exams, thereby enhancing diagnostic accuracy and patient safety. Question 18. When analyzing the potential causes of image artifacts in digital mammography, Mr. Evans, a 47-year-old patient, presents with an exam that shows an unexpected artifact obscuring part of the breast tissue. As the responsible technologist, what should be your first action to mitigate the artifact and ensure diagnostic clarity? A. Immediately notify the radiologist of the artifact without attempting any corrective measures. B. Ignore the artifact and proceed with the interpretation based on the remaining image quality. C. Reposition the patient and adjust the exposure settings without considering equipment factors. D. Investigate the origin of the artifact by checking for any external contaminants, proper equipment, cleaning and disinfection, and then repeat the acquisition if necessary. Answer. Correct answer, D. Investigate the origin of the artifact by checking for any external contaminants, proper equipment, cleaning and disinfection, and then repeat the image acquisition if necessary. Explanation. Image artifacts in mammography can significantly interfere with the detection of potential abnormalities. The correct approach involves a systematic investigation to identify whether the artifact is due to external contaminants, e.g., residue on the image receptor, suboptimal equipment, cleaning, or technical issues. After identifying and rectifying the cause, the technologist should repeat the acquisition to ensure that the resulting image is free from artifacts and meets diagnostic standards. This method conforms to ARRT quality control protocols and ensures that patient care is not compromised by technical deficiencies. Question 19. Throughout the course of a mammographic examination, the proper understanding of system geometry is essential to optimize image quality. Mrs. Nguyen, a 55-year-old patient, has recently undergone a mammogram where issues related to source to image distance, SID, object image distance, OID, and magnification were noted. What is the most crucial aspect in managing these geometry settings to maintain diagnostic accuracy? A. Only focus on increasing the SID for all patients regardless of breast size. B. Adjust the OID based on the patient's breast thickness and positioning, ensuring that magnification remains minimal to avoid image distortion. C. Primarily prioritize magnification to highlight smaller areas of concern even if it affects the SID and OID. D. Use standardized settings without customization for individual patients. Answer. Correct answer. B. Adjust the OID based on the patient's breast thickness and positioning, ensuring that magnification remains minimal to avoid image distortion. Explanation. The interplay between SID, OID, and magnification is critical for achieving optimal image quality in mammography. Adjusting the OID according to the patient's breast thickness and positioning is vital in order to minimize magnification errors, which in turn can distort the size and appearance of lesions. Maintaining minimal magnification is essential for accurately interpreting subtle abnormalities. This approach is supported by technical guidelines in mammography, which stress the importance of adapting imaging geometry to individual patient characteristics in order to maximize diagnostic accuracy and adhere to quality control standards. Question 20. In response to the increasing integration of digital informatics in mammography, Mr. Anderson, a 63-year-old patient, is undergoing an exam using a state-of-the-art digital system that incorporates the picture archiving and communication system, PACS, for storage, retrieval, and backup of images. Given the complexity of integrating digital image display with electronic medical records, EMA, what best practice should the technologist follow to ensure efficient operation and high-quality imaging output? A. Rely solely on the automated settings of the digital system without any manual intervention for quality assurance. B. Focus primarily on the manual adjustment of exposure settings, disregarding the integration aspects of PACS and EMA. C. Ensure proper calibration of both the digital display monitors and the image acquisition parameters while maintaining regular quality control checks and effective communication with the Department for Informatics issues. D. Delay all procedures until a complete system overhaul is performed by the manufacturers. Answer. Correct answer. C. Ensure proper calibration of both the digital display monitors and the image acquisition parameters while maintaining regular quality control checks and effective communication with the Department for any informatics issues. Explanation. In the digital era of mammography, maintaining seamless integration between the image acquisition system, PACS, and EMA is critical for ensuring high-quality imaging output and efficient workflow. Requires A proactive approach that includes proper calibration of digital display monitors, rigorous quality control tests, and constant collaboration with the department to address any technical issues as they arise. This approach not only ensures optimal image quality but also enhances the workflow and data integrity as required by industry guidelines and accreditation bodies such as the ARRT and MSA. Question 21. In the context of deciding on repeat imaging procedures, Mrs. Franklin, a 52-year-old patient with extremely dense breast tissue, presents for her annual screening mammogram. During the exam, the technologist notices a region of subtle asymmetry that is ambiguous, and an early screening anomaly appears that is not clearly definable on the initial images. Mrs. Franklin has no known family history of breast cancer, but her breast density is known to sometimes mask lesions or create false positive findings. Given these factors and the potential for both technical and anatomical challenges in dense tissue, what is the most appropriate course of action in managing repeat imaging? The decision must align with the principles of minimizing unnecessary radiation exposure while ensuring diagnostic accuracy. The technologist should consider available guidelines, such as those outlined by the ARRT and MSA, which emphasize the importance of comparing current and previous exams along with repeat imaging if indicated. I immediately refer Mrs. Franklin for a full diagnostic workup without reviewing prior images. B. Advise the patient that the initial images are conclusive and forego any additional imaging. C. Compare the current images with previous examinations and, if needed, perform targeted repeat imaging to clarify the ambiguous area. D. Request an alternative imaging modality, such as an ultrasound, as the only follow-up measure regardless of mammographic findings. Answer. Correct answer. C. Compare the current images with previous examinations and, if needed, perform targeted repeat imaging to clarify the ambiguous area. And explanation. In patients with dense breast tissue, ambiguous findings are not uncommon due to the masking effects of the dense tissue. The ARRT and MSA guidelines stress that a careful comparison between current and prior mammograms is essential to determine whether a finding represents a true abnormal or is simply an artifact of breast density. Repeat imaging, targeted compression, or spot views should be performed when the initial result is inconclusive, as it can help enhance lesion detection while adhering to ARRT principles. This approach avoids unnecessary radiation exposure while ensuring that the subtle anomaly is thoroughly evaluated. Question 22. When establishing effective patient rapport and addressing emotional and physical needs, Mr. Jackson, a 60-year-old patient with a long history of anxiety and discomfort during previous imaging procedures, arrives for a screening mammogram. He expresses concerns about the overall process, especially the compressive force applied during the exam and the duration of exposure to what he perceives as an invasive procedure. The technologist is responsible for easing his anxiety and ensuring optimal image acquisition without compromising patient comfort. How should the technologist approach Mr. Jackson's concerns given that patient-centered care is a critical component of quality mammography practices as recommended by the ACTS and ACCA guidelines? A. Ignore his expressed concerns and proceed with the standard protocol without additional reassurance. B. Inform Mr. Jackson that his anxiety is irrelevant and that the procedure must be completed as scheduled. C. Offer a modified approach by explaining each step beforehand, employing relaxation techniques and providing verbal reassurance while ensuring that the exam is completed effectively. D. Reschedule the exam for a later date without addressing specific issues to avoid immediate confrontation. Answer. Correct answer. C. Offer a modified approach by explaining each step beforehand, employing relaxation techniques and providing verbal reassurance while ensuring that the exam is completed effectively. Explanation. Establishing rapport and providing psychological support are essential for mitigating patient anxiety. The guidelines set forth by the ARRT emphasize the importance of clear pre-exam communication and patient education, as this not improves cooperation but can also enhance image quality by reducing involuntary movements. By explaining each step of the procedure, employing relaxation techniques, and reassuring Mr. Jackson, the technologist aligns with patient-centered care principles while maintaining the diagnostic integrity of the exam. Ignoring concerns or simply rescheduling without explanation can result in diminished patient trust and potentially lower compliance in future. Question 23. Given the emphasis on radiation safety principles and adherence to the ALARA as low as reasonably achievable guidelines, Mr. Rogers, a 55-year-old patient undergoing a diagnostic mammogram, expresses concern about his exposure to radiation. He has read conflicting information online and is particularly worried that the procedure might exceed safe levels. As the technologist, your role includes clarifying these concerns by considering facts like shielding and exposure parameters. What is the most appropriate response to Mr. Rogers regarding the implementation of radiation safety principles during his exam? A. Explain that the radiation dose is high but necessary for image quality and not much can be done to reduce it. B. Detail that the use of optimized exposure parameters, proper patient positioning, and effective shielding techniques is employed to ensure that the radiation dose remains as low as reasonably achievable without compromising image quality. C. Recommend against the mammogram entirely due to the potential risks associated with radio exposure. D. Dismiss his concerns by assuring him that modern equipment makes radiation exposure irrelevant. Answer. Correct answer. B. Detail that the use of optimized exposure parameters, proper patient positioning, and effective shielding techniques is employed to ensure that the radiation dose remains as low as reasonably achievable without compromising image quality. Explanation. Explaining radiation safety measures is essential to alleviate patient concerns about radiation exposure. ALARA principles are fundamental to minimizing radiation risk, and mammography equipment is designed to optimize exposure based on breast density and size while applying proper shielding when necessary. This detailed explanation informs Mr. Rogers that every measure is taken to balance diagnostic quality with minimal radiation exposure, thereby reinforcing his confidence in the safety of the exam. Modern regulatory standards from the FDA and guidelines from the ACA further support these practices. Question 24. In terms of accurately documenting patient information and exam details, Ms. Russo, a 48-year-old patient with multiple comorbidities and a complex breast health history, is undergoing her routine screening mammogram. Ensuring the correct documentation of prior images, patient history, and any observed anomalies is crucial for subsequent evaluation by the radiologist. The documentation process plays a pivotal role, maintaining continuity of care, meeting MSA requirements, and upholding HIPAA standards. What is the most appropriate practice for the technologist to follow when documenting MS? Russo's exam information. A. Record all pertinent patient details. Compare with previous exams and ensure that all findings are accurately communicated to the radiologist while maintaining strict adherence to HIPAA confidentiality protocols. B. Document only the basic imaging details since any issues will be noted by the radiologist later. C. Share patient details verbally with the radiologist without written records to speed up the process. D. Documentation if the exam appears routine and normal. Answer. Correct answer. A. Record all pertinent patient details, compare with previous exams, and ensure that all findings are accurately communicated to the radiologist while maintaining strict adherence to HIPAA confidentiality protocols. Explanation. Comprehensive documentation is critical in mammography for tracking changes over time, ensuring diagnostic accuracy and fulfilling regulatory requirements, such as those outlined by MSA. HIPAA. The technologist must meticulously record the patient's history, imaging technique, and any nuances observed during the exam. This detailed record is indispensable for effective radiologic interpretation and continuity of care. IACA emphasizes that detailed documentation supports both quality control and medico-legal standards, ensuring that each exam is thoroughly reviewed and compared with previous studies. Question 25. In light of the advanced design characteristics of mammography units, Mr. Garcia, a 57-year-old patient, is scheduled for a screening exam on a new digital system featuring state-of-the-art 2 components and filtration technology. The facility has recently upgraded its equipment, and the technologist must adjust the imaging parameters to optimize image quality while considering the unique design features of the new unit. Given, mammography tube includes critical components such as the anode, filtration, and the window design. Which of the following is the primary consideration to ensure that the superior design benefits are maximized during Mr. Garcia's exam? A. Focus solely on increasing the KVP to improve penetration, ignoring filtration adjustments. B. Adjust only the compression settings while relying on the unit's automatic calibration. C. Utilize fixed set of exposure parameters without considering individual patient characteristics. D. Optimize exposure factors by understanding the role of the tube's anode infiltration in enhancing image contrast and reducing scatter. Customizing parameters based on Garcia's breast composition. Answer. Correct answer, D. Optimize exposure factors by understanding the role of the tube's anode infiltration in enhancing image contrast and reducing scatter, while customizing parameters based on Garcia's breast composition. Explanation. Modern mammography units are designed with sophisticated two components that significantly impact image quality. The anode and filtration work together to produce optimal X-ray spectra, enhance contrast, reduce scatter radiation. By tailoring the exposure parameters to the patient's breast composition, the technologist can exploit these design features to achieve diagnostic quality images while minimizing radiation dose. Understanding these technical nuances aligns with ARRT guidelines on equipment performance and ensures compliance with MESA standards. This comprehensive approach maximizes both image quality and patient safety. Question 26. In response to occasional technical issues within the digital imaging workflow, Isa White, a 50-year-old patient, experiences delays in the retrieval of her mammogram images due to potential picture archiving and communication system (PACS) issues. The technologist is responsible not only for acquiring quality images, but also for ensuring timely image transfer and accessibility in the integrated digital environment. What is the appropriate first step for the technologist to address these PACS-related technical issues while ensuring that patient care is not compromised? A. Immediately switch to paper-based records and forego digital archiving. B. Ignore the issue and rely solely on the radiologist's interpretation of the images on the acquisition workstation. C. Troubleshoot the PACS by verifying network connections, reviewing recent system logs, and consulting with the department if necessary to resolve any potential hardware or software faults. D. Recommend the patient undergo repeat exam on difference without first investigating the digital issue. Answer. Correct answer. C. Troubleshoot the PACS by verifying network connections, reviewing recent system logs, and consulting with the department if necessary to resolve any potential hardware or software faults. Explanation. Efficient integration between image acquisition systems and PACS is essential to ensure that images are readily available for prompt diagnosis. When technical issues arise, the technologist should first perform standard troubleshooting procedures by checking network connectivity and reviewing system logs for errors. In many facilities, immediate collaboration with the department is crucial to resolve such problems swiftly. This systematic approach minimizes delays and ensures that subsequent evaluations are not adversely affected by upholding the regulatory and quality assurance guidelines set forth by the ARRT or MESA. Question 27. With respect to the matter of patient radiation exposure, Mr. Keller, a 53-year-old patient, voices concern regarding the cumulative radiation dose from repeated mammography exams over the years. He is particularly apprehensive about the potential long-term risks associated with radiation exposure. As a mammography technologist, how should you address his concerns while reinforcing that the exam is performed within safe limits in accordance with ARRT principles and established regulatory standards? A. Dismisses concerns by stating that all modern mammography equipment completely eliminates radiation risk. B. Explained that each exam is carefully calibrated using optimized exposure parameters and that the dose is minimized according to ARRT guidelines, ensuring that the benefits of early detection far outweigh the minimal risks. C. Agree that radiation exposure is dangerous and suggest limiting future exams. D. Inform him that the radiation dose is high. It is a necessary trade-off for accurate diagnosis. Answer. Correct answer. B. Explain that each exam is carefully calibrated using optimized exposure parameters and that the dose is minimized according to ARRT guidelines, ensuring that the benefits of early detection far outweigh the minimal risks. Explanation. It is essential to reassure patients like Mr. Keller that the cumulative radiation dose from mammography is very low and is strictly monitored. Modern mammography units are designed to operate within the ARRT framework, meaning that every effort is made to keep the exposure as low as reasonably achievable while obtaining high-quality diagnostic images. The benefits of early breast cancer detection significantly outweigh the marginal risk posed by radiation exposure. Additionally, Adherence to regulatory standards, such as those established by the FDA and the MKSA, further reinforces that the process is safe. A clear evidence-based explanation to alleviate his anxiety and fosters informed decision-making. Question 20. In terms of patient education and adherence to CSACA screening guidelines, MS lead, a 47-year-old woman with a moderate family history of breast cancer is preparing for her first screening mammogram. She is curious about the rationale behind the recommended screening intervals and the age at which regular screening should begin. Given the evolving guidelines and varying risk levels, what is the most appropriate explanation that should be provided? MSB regarding her screening schedule. A. Inform her that based on the latest CSACA guidelines, women with a moderate risk should begin annual screenings at age 40, with adjustments made according to individual risk factors and personal health history. B. Advise her that screening guidelines recommend waiting until age 55 regardless of risk history. C. Explain that the screening frequency is fixed and does not vary by individual risk factors or family history. Recommend monthly self-examinations as a substitute for regular imaging until she reaches age 60. Answer. Correct answer A. Inform her that based on the latest CSACA guidelines, women with a moderate risk should begin annual screenings at age 40, with adjustments made according to individual risk factors and personal health history. Explanation. CSACA screening guidelines emphasize that screening protocols must be tailored to individual risk profiles. For a patient like MS with a moderate family history, early and annual screen generally advised starting at age 40. This approach allows for early detection and intervention, which is critical for improved outcomes. The explanation should reinforce that guidelines are evidence-based and can vary according to personal health history and risk factors. Providing this clear rationale helps MS Lee understand the importance of regular screening and empowers her to be proactive in her breast health management. Question 29. Among the various educational strategies to enhance patient involvement, Isis Rogers, a 49-year-old patient with no significant family history, has just completed a screening mammogram. Following the exam, the technologist is tasked with reviewing key self-examination practices, including breast self-examination (BCs), to empower her to detect any future changes. Given the importance of early detection and patient participation, ongoing breast health monitoring, which statement best captures the recommended approach for discussing BSE with Isis Rogers? A. Emphasize that BC is outdated and unnecessary when regular mammograms are performed. B. Explain that only a clinical breast examination (CBE) performed by a healthcare professional is important for early detection, rendering self-examinations redundant. C. Advise that BSE should be performed daily as the primary means of detecting abnormalities, replacing the need for clinical imaging. D. Educate her on the proper techniques. Recommended monthly schedule for BSE while clarifying that BSE is a supplementary measure to regular mammograms and clinical examinations. Answer. Correct answer. D. Educate her on the proper techniques and recommended monthly schedule for BSE while clarifying that BSE is a supplementary measure to regular mammograms and clinical examinations. Explanation. While regular screening mammography and clinical breast examinations are the cornerstone of early breast cancer detection, patient education on proper breast self-examination, BC's techniques remains valuable. Educating patients like Isis Rogers on how to recognize changes in their breast tissue reinforces their active role in their own healthcare. The recommended practice is to perform BSE monthly and use it as an adjunct to professional screenings rather than as a replacement. This patient-centered approach, supported by ACT's guidelines, ensures that the patient is equipped with the knowledge to detect subtle changes between formal screenings. Question 30. Throughout the process of providing a comprehensive mammographic exam, recognizing potential adverse reactions is crucial to ensure patient safety. Vista Clark, a 62-year-old patient with a history of mild allergic reactions to contrast media during other radiological exams, is scheduled for a diagnostic mammogram that may require additional imaging sequences. Although contrast is rarely used routinely in mammography, the possibility of adverse reactions requires that the technologist be vigilant and prepared. What is the best practice for managing and mitigating the risk of Reactions during Clark's exam. A. Omit any form of contrast administration under all circumstances, even if additional imaging would provide critical diagnostic information. B. Ignore his past allergic reaction history since contrast is rarely used in mammography and proceed without any precautions. C. Prepare by reviewing his allergy history, ensuring that resuscitation equipment and appropriate medications are immediately available, and closely monitoring him throughout. Exam for any signs of reaction. D. Advise him that no adverse reactions have ever been reported in mammography and dismiss his concerns without additional safeguards. Answer. Correct answer. C. Prepare by reviewing his allergy history, ensuring that resuscitation equipment and appropriate medications are immediately available, and closely monitoring him throughout the exam for any signs of reaction. Explanation. Even though contrast is not routinely used in standard mammography, there are diagnostic situations where its use may be considered, especially in complex cases. For patients like Clark who have mild allergic reactions, it is imperative to be fully prepared for the possibility of an adverse reaction. This includes a thorough review of his allergy history, having emergency protocols and necessary medications available, and monitoring the patient closely during and after the exam. Such precautions align with established radiological safety standards and guidelines set forth by the ARRT and MKSA, ensuring that potential adverse events are managed promptly and effectively while maintaining patient safety.